Chairman Burke, Vice Chair Huffman, and Ranking Member Antonio, thank you so much for your time. My name is Dr. Erika Boothman. I'm a physician resident specializing in obstetrics and gynecology. I received my medical degree from the Ohio State University College of Medicine, and I earned a master's in public health from Johns Hopkins University. I've lived in Columbus since 2011 and plan to practice obstetrics and gynecology in Columbus after my residency. As an obstetrician gynecologist, I am here to express my strong opposition to Senate Bill 23. I want to start off by saying it's incredibly frustrating that we're back here. We're here yet again discussing removing autonomy from women. I am here asking you to vote no on this bill, a bill that the majority of Americans do not support. I am here as a doctor who has promised to take care of women in whatever condition they present. I am here telling you that this will lead to worse outcomes for women in Ohio. Every day, I use my training to counsel patients so that they may identify and choose smart medical decisions for themselves. I'm standing here on behalf of my patients, Ohio women, your constituents, telling you that supporting this bill is a poor choice. The majority of women who have abortions are already mothers. With Ohio's abysmal infant mortality rate, Ohio cannot afford to pass a bill that would harm Ohio mothers, potentially making them unable to care for their existing children. Proponents of this bill seem not to be moved by arguments expressing concern for the life and health of Ohio women. I ask you then to consider how passing this bill would impact the quality of medical professionals that major Ohio universities attract. I am a resident OBGYN at a local hospital, and every year my program interviews about 100 medical students for 11 OBGYN residency positions. We interview about 25 medical students at a time. At the last round of interviews, I was giving tours of the hospital, and 7 of the 15 applicants in the room approached me and stated that they were strongly considering our residency program, but they were from out of state, and they had heard that Ohio has been chipping away at women's reproductive rights. They expressed trepidation at the thought of spending their 4 most formative years of training in a state that has established itself as hostile towards women's rights. They were wary of practicing in a state that has decided repeatedly that the lawmaker-patient relationship is more important than the doctor-patient relationship. A large percent of physicians practice in the state in which they complete their residency. These are bright-minded individuals. These are individuals who will be working toward lowering the infant and maternal mortality rates of this state. These are the doctors that in 4 years are replacing the doctors that are retiring. These are the doctors taking care of you, your family, and your loved ones. As a junior fellow of the American College of Obstetricians and Gynecologists, I would like to cite their position on safe, legal abortion. Induced abortion is an essential component of women's health care. Like all medical matters, decisions regarding abortion should be made by patients in consultation with their health care providers and without undue interference by outside parties. Like all patients, women obtaining abortion are entitled to privacy, dignity, respect, and support. As you may know, ACOG is the nationally recognized foremost organization dedicated to the improvement of women's health. ACOG, through its members, produces guidelines and educational material viewed as the standard of care for patients. It is committed to ensuring optimal women's health, and it has repeatedly stated that the organization is opposed to legislative proposals that limit women's access to medical care. This bill would harm women. This bill would deter smart medical minds from choosing to practice and train in Ohio. Supporting this bill is the wrong decision. Because of this, I urge you to vote no on Senate Bill 23.